Hello and good morning, Mrs. S. It's nice to see you again. The primary reason for us meeting again today was due to Dr. RN's concerns about attentional function and to discuss your psychological assessment report results. If you have any questions or concerns about the results of your evaluation, please feel free to interrupt me at any time as I discuss. Going over the summary of test results. Due to your anxiety, some of the assessment performances observed may have been impacted to some degree of measurement. However, the results are still reliable and valid interpretations. The central executive functions examined during the Attentional Function Index AFI assessment were cognition-based, such as working memory, retention, concentration, executive function skills. The examination found that your cognitive abilities, spelling, writing, reading, etc., were average apart from the math. However, due to the suspected test anxiety scores might have been likely compromised, skewed just a little bit. Informational processing measurements noted that your speed and accuracy were consistent with an ADHD diagnosis. More assessments must be rendered and analyzed before a proper diagnosis can be made. No communication impairments were noted. No evidence was congruent with a retentive memory problem, but you demonstrated a mild impairment in initial learning attention probabilities, meaning you retain all the information you gather after the onset of the initial delay in working memory. Your primary executive function exhibited general response inhibitions. The MMPI 3 personality and mood assessment revealed that while you meet the criteria of moderate depressive disorder, there is no indication of self-harm. So not high risk. However, it is cautioned that once in a conducive psychological treatment, you should not be quick to terminate therapy. As symptomologies subside, they can always manifest, causing therapy regressions. The diagnosis that I have for you, Miss S, is you suffer from C-PTSD, which is complex post-traumatic syndrome disorder, GAD, which is general anxiety disorder, and moderate mood disorder. Further evaluations, however, need to be rendered for your suspected ADHD, such as an ASRS test, a self-reporting scale. A clinical interview to assess your depression using a PHQ, a patient health questionnaire, would also benefit you. All of your diagnoses hinder your ability to focus. Therefore, further treatment and assessments are in your best interest. Some of the recommendations I have after reading the results to you, going over my notations, I feel it would be in your best interest to receive individual therapy sessions to monitor the progressions of your mental health while noting if any additional therapy treatments may be warranted or needed. Thank you, Ms. S, for sharing your valuable time with me to disclose and share your results. Here's a copy of your psychological assessment for you to keep in your records. Again, if you have any concerns or questions, please call my office or make another appointment to come back and see me. I hope you have a wonderful day.